Hello, my name is Dr. Shruti Shastri. I'm a pediatric endocrinologist at Aster CMI Hospitals, Bangalore. In today's video, I am going to be discussing about puberty in both boys and girls and at what point you should be concerned and think about visiting a pediatric endocrinologist. Puberty is a period of adolescence when certain hormones begin to rise, preparing your child for transition from childhood into adulthood. This typically happens when the pituitary gland or the master gland of the body, which is present in the brain, starts to make two hormones called luteinizing hormone and follicular stimulating hormones. You can just call it as LH and FSH. So these two hormones will talk to the ovaries in females to make the female hormone called estrogen, or it talks to the testicles in males and prompts it to make the male hormone called testosterone. So in girls, the first sign of puberty is breast development, and usually 2 to 3 years after the breast development starts, your child will have her first menstrual cycle. Now, if a girl starts puberty before the age of 8 years, this is called early or precocious puberty. In order to determine if they indeed have precocious puberty, we will examine the child thoroughly. We will also look at the growth charts to see if there's any growth spurts, and we will also get some blood tests, obtain a hand x-ray, which is also called a bone age x-ray to assess the maturity of the bones, and obtain a brain MRI. If we determine that the child has precocious puberty, your pediatric endocrinologist may suggest blocking puberty up until they are at an age when they can normally resume puberty. Now coming to delayed puberty, this is defined when the girl does not have any breast development up until the age of 13 years, or if they have started breast development and have not had a period even 4 years after the breast development has started. Again, your endocrinologist will assess what the underlying cause for this is and provide appropriate treatment. Now coming to boys, the first sign of puberty is testicular enlargement. Now this might not be commonly apparent to either the child or the family or even a regular doctor. So these boys can undergo puberty anytime between ages of 9 to 14. If it happens before the age of 9, it's called early puberty or precocious puberty in boys. Or if it happens after the age of 14, it's called delayed puberty in boys. The most common cause of delayed puberty in boys is something called as constitutional delay of puberty, which basically comes from either one of the parents if one of you have started your periods later. And this is not of any harm, but in order to make sure that there's no underlying disease that's contributing to this, we will obtain some blood work as well as some hand x-ray or the bone age x-ray to make sure that there's nothing more sinister that is contributing to this. Now that you understand about puberty and its timings, I hope that you will know when to consult with a pediatric endocrinologist. As always, we are happy to answer queries and are available at Aster CMI Hospital, Bangalore.